Every delivery tells a story, and in obstetric coding, you are the storyteller. One wrong code, one missed rule, and a perfectly documented delivery can turn into a denial, a compliance issue, or a lost claim. Today, we're diving into one of the most misunderstood topics in ICD-10 CM Chapter 15, normal delivery versus cesarean section coding. And by the end of this video, you'll know exactly when to use O80, when O82 is allowed, and when both of them should stay far away from your claim. Let's be honest, O80 and O82 look simple, but they are among the most misused codes in obstetric coding. And here's why. The problem is rarely lack of knowledge. The problem is misunderstanding the rules behind the story. So before we code anything, remember this golden rule. Chapter 15 codes always take sequencing priority. If a pregnancy or delivery code applies, it leads the claim. Always. Now let's talk about O80, Encounter for Full-Term Uncomplicated Delivery. Here's the first myth we need to destroy. O80 does not mean vaginal delivery. O80 means perfection. It represents a full-term, uncomplicated delivery of a single, healthy baby by spontaneous vaginal delivery with no complications. Not before delivery, not during delivery, and not postpartum for that encounter. All 5 conditions must be met. Miss even one, and O80 is gone. Here's an important tip many coders miss. If the patient had a complication earlier in pregnancy, but it was fully resolved before admission, O80 is still allowed. Let's apply this to a real-world example. A 39-week patient is admitted in spontaneous labor. She delivers a healthy baby boy vaginally. No complications are documented. Your coding is clean and simple. Principal diagnosis, O80, Encounter for Full-Term Uncomplicated Delivery. Outcome of delivery, Z37.0. Single live birth, the only outcome code allowed with O80. Weeks of gestation, Z3A.39, 39 weeks gestation of pregnancy. That's textbook perfect obstetric coding.
Now let's move into dangerous territory, C-sections. This is where coding errors explode. C-section coding has 2 paths, elective and medically indicated. Let's start with O82, Encounter for Cesarean Delivery Without Indication. O82 is one of the most restricted codes in Chapter 15. It is used only when the C-section is done at the mother's request, and there is no medical indication whatsoever. Even a minor complication, like mild gestational hypertension, immediately disqualifies O82. If there's a complication, you code the complication, not O82. Here's an elective example. A patient at 39 weeks requests a C-section for personal reasons. The physician clearly documents maternal request. No medical issues are present. Correct coding, principal diagnosis, O82, Encounter for Cesarean Delivery Without Indication. Outcome, Z37.0, Single Live Birth. Weeks, Z3A.39, 39 weeks gestation of pregnancy. Clean, compliant, defensible. Now, let's talk about medically indicated C-sections. This rule is critical. Memorize it. The reason for the surgery becomes your principal diagnosis, not the procedure, not O82. For repeat C-sections, you code the previous uterine scar. Low transverse scar, O34.111, maternal care for low transverse scar from previous cesarean delivery. Vertical scar, O34.312, maternal care for vertical scar from previous cesarean delivery. And if labor begins before a scheduled C-section, you add O75.82, onset spontaneous of labor after 37 completed weeks of gestation, but before 39 completed weeks gestation, with delivery by planned cesarean section. This is where specificity protects you during audits. Before we finish, let's talk about supporting characters, your Z codes. A maternal record is never complete without them. A Z37 outcome code is mandatory whenever a delivery occurs. This data feeds hospital quality metrics and public health reporting. And weeks of gestation must always be coded using completed weeks only. 38 weeks and 6 days, you code Z3A.38, not 39.
Let's close with a multiple gestation scenario. A patient delivers twins by indicated C-section due to breech presentation of fetus A at 37 weeks. Your coding looks like this. Principal diagnosis, O32.1XX0. Maternal care for breech presentation, not applicable or unspecified, for breech presentation. Twin pregnancy, O30.003. Twin pregnancy, unspecified number of placenta and unspecified number of amniotic sacs, 3rd trimester. Outcome, Z37.2 for twins, both live-born. Weeks, Z3A.37. That's accurate, complete, and audit-ready. Here's the final takeaway. Mastering O80 and C-section logic isn't just about passing exams. It's about accuracy, compliance, and protecting revenue. Specificity prevents denials, and correct sequencing tells the true clinical story. If this video strengthened your obstetric coding skills, hit like, subscribe, and check the description for more practice scenarios. Until next time, happy coding! Thanks for watching this video. Bye-bye.